Hello, my name is Mac Holmberg. I'm a general internist over at the Roosevelt Clinic here at UW in Seattle. I took over doing Medical Jeopardy last year from Mo Hagman, who is incredible and did it, I think, for quite a number of years. Last year, I think, was a very exciting year with lots of enthusiasm from all the learners and the competitors. And so we're going to try a slightly different format this year to make it so that people can pace themselves with how they're learning the content here. So we will go through Jeopardy, and then I will be reading the questions, and then I will go to the slide. That's when our contestants can buzz in. And afterwards, I do have some learning points for some of the content here. So I want to just slow things down so we can learn a bit more. All right. Let's get going. All right, so we have our categories here. We have contagious canvas. Why can't I breathe? You goiter be kidding me. Filter me, daddy. And does it cause autism? I'm so excited to hear the variety of responses emotionally to this. Okay. I did a random number generator before this, and it said that Skagit is actually going to be going first. So, Skagit, take it away. So, does it cause autism? 200. So the question is, as per Alquist et al.'s 2024 study, this commonly used antipyretic is not associated with an increased use or an increased risk of autism. All right, and so let's see, who was that? Skagit? Skagit, what is your answer? And please answer in the form of a question. What is acetaminophen? Can you pronounce it in the way that it was pronounced in the press conference? Oh, sorry, Liz. Who wants to help keep score? Oh, yeah. Yeah, perfect. Thank you so much for that extra bit of time. Who wants to do it? We're going to assign somebody if they don't. I'm feeling like maybe. Yeah, who said they would do it? Somebody volunteered. Oh, Tony. Tony, let's have Tony, Dr. Brassfield. Thank you so much. Everyone give Dr. Brassfield a round of applause. Our outpatient chief resident at the Roosevelt and Primary Care and OB-GYN Clinic. I think they signed up for it. I don't think any of us like do a chief here without thinking that we're going to get harassed. Yes, if you want to come right up here and just keep track of the score. Just got so excited, especially when you picked I love how you called it the neurology category. Maybe we can call it the, I don't know, conspiracy theory category. Okay. All right. So thank you, Kim. All right, Skagit. Filter me, daddy, for 200. This subtype of urinary incontinence is the most common in women. Trios. Correct. What is stress urinary incontinence? 200 for trios. All right, trios. This is the most common cause of primary adrenal insufficiency. That is incorrect. That is incorrect. UW. That is incorrect. Yes. That is incorrect. Wait, who was that? Oh, I don't think you can. I don't think you can go again. Yeah. Okay. Does anybody else want to answer? So autoimmune adrenalitis is the correct answer. So, no, I did not accept. I think going with the category for it because I think there's a couple other things that are going for it. Okay. I don't think anybody got it. Or did, yeah, so I think they all subtract points for that. Guess I consider in that category.
It's not, we didn't, three did not, their answer.
Yeah, the scorekeeping seems like actually the most stressful job. Yeah, yeah, yeah. We should have had. Yeah, so you're gonna rage the trios and then, all right. Okay. Let's see who, yeah. It is. I think I was going for autoimmune adrenalitis as opposed to Addison's disease because I think there are other forms of autoimmune disease that can cause primary adrenal insufficiency. Fair. We'll put this one in the parking lot, and if it is like something that comes back later, then I think we can readdress it. Okay, great. So let's go to who was trios. Yeah. So trios. All right. These two statins have the strongest association with type 2 diabetes onset. Name both. Yeah.
What is rosuvastatin?
Correct. Atorvastatin and rosuvastatin. All right. Skagit. Right. Rembrandt's portrait of Gerard de Lassay depicts this infectious disease. That is technically incorrect. Let's see, who was that? Yeah, Virginia Mason. What was that? Incorrect. It is not leprosy. Okay, so St. Joe has the correct answer with what is congenital syphilis. We have a saddle nose deformity here depicted in this photo. Okay, great. So St. Joe. Hemolytic transfusion reactions are a result of this pathophysiologic mechanism. Ooh. Oh gosh, I actually don't think I looked at the hypersensitivity reaction. Can someone verify that type 2 it is a type 2 hypersensitivity reaction? What, sorry? Yeah. Okay, so I guess yes, I think we'll give it to Virginia Mason, and I think in the sense for that, we will give Skagit the points for early for the Addison's disease. What I was going for here is ABO incompatibility. Yeah. Okay, let's go back. Virginia Mason. I'm so sorry, Tony. All right, so what did you say? All right, so this portrait of Niccolo Paganini depicts his large hands and suggests this diagnosis. What is acromegaly? That is incorrect. Virginia Mason? Incorrect. Correct, Marfan syndrome. The thought was either likely Marfan syndrome, but also I think there was some thought he might have had EDS. I think more so the former. All right, UW. All right. This medication alkalizes urine to help treat uric acid stones. St. Joe? That is incorrect. I think so. I think for the resetting, I think the process of that should be, let's wait until after the person has answered the question, and then we can have people buzz in. I think in the spirit of that, I think since you would reset it and then UW had chimed in, we'll do that, and then we'll come to you if they get it incorrect. All right, so UW? Correct, potassium citrate. All right. All right, UW? Okay. This disease is shown. This disease is shown on electron micrograph. Incorrect. UW. Correct. Minimal change disease. You can see this from the podocyte effacement and how all the podocytes have become all glommed together. All right. Back to UW. This is the only FDA-approved medication for intracavernosal injection therapy for erectile dysfunction. Madigan? Correct. What is alprostadil? This is often used in combination with a couple other medications, piperavine, phentolamine, and/or atropine. It's interesting. I feel like the VA associated team answering that question correctly. Yeah. All right. So Madigan? This 14th century encyclopedia called Onum Bonum depicts a priest giving instructions to people living with this disease. UW? Correct. What is Hansen's disease? Let's try to call it Hansen's disease. All right. UW? Oh, so would you mind telling me what you would like to wager? You can wager up to the top of the category or the amount of points that you have. Okay, so going to wager 800, and only the person that selects this may answer. So this woodcut by Yoshikazu is from around 1851 and depicts legendary figure Tamatomo banishing a demon meant to represent this illness, which ravaged Japan throughout the centuries. Two, one. Incorrect. It is not tuberculosis. This is actually smallpox. Yeah, what is smallpox? Love the crowd response. All right. I think so, yeah. All right. And so I think we go back to UW for that one. All right. All right. These pregnancy-associated conditions are associated with autism spectrum disorder. Name two. Oh my God, it's also a daily double. Sorry, I forgot. All right. Now, what is our point total right now, Tony? 700. You have 700, so you can wager 700 or 500. Up to 700 or 500. 300. Okay, knowing that this is a bit cattywampus because I told you it's a daily double after. Okay, great. So wagering 300. So what is your answer? 5, 4, 3, 2. So that is incorrect. Preeclampsia is on that list. Alcohol use is not. I think alcohol use we'd associate more with probably fetal alcohol syndrome. And then also, I'm sure there's a association mixed in there, I think, but from the studies that I was reading, the ones that we really see associated with autism are maternal obesity, diabetes, gestational hypertension, preeclampsia, infection during pregnancy, and then short interpregnancy intervals. The point I did want to bring up with this is that, there's a lot of talk about autism right now in the community, and there is a long and unfortunate and storied past of blaming mothers for causing autism. And I think when we talk about pregnancy-associated conditions, it's really important to not put blame on mothers. There is this horrific phrase called a refrigerator mother that was used to blame mothers to say that they were distant and cold, and this caused their kids to have autism. And so I just really wanted to bring that point up as we talk about what we've seen in the epidemiologic studies. Oh, okay. I think we're back to UW. All right. After diabetes and hypertension, this is the most common cause of nephropathy worldwide. UW? Correct. IgA nephropathy. Right. Back to UW. This anatomic change is often responsible for infertility in male patients with cystic fibrosis. Correct. Congenital absence of the vas deferens. Do you guys know which mutation this is related to? Sodium channel. Yeah, it's always a sodium channel. We hate those. Yeah. So CFTR mutation. Okay, great. UW. This category and/or specific diagnosis is the most common cause of female infertility. Name one. Skagit. Correct. So ovulatory dysfunction and/or polycystic ovary syndrome. Great job. All right, Skagit. This paternal factor is associated with an increased risk for autism diagnosis. Trios? Yes, so increased paternal age. There's actually a 21% increase in ASD diagnoses in offspring for every 10-year increase in paternal age. All right, Trios? Okay. Up to 40% of patients with cold urticaria may experience this complication when doing a polar plunge or a full body cold water immersion. UW? Incorrect. WSU? Correct. Anaphylaxis. So when your patients have, when they talk about cold urticaria, they get hives when they're walking out and they into the cold. It actually, my friend who's an allergist recommended that you actually do give people EpiPens for that and tell them to not do cold water like submergence, because that is like the classic thing in the literature is people do a polar plunge to raise money. And then that's the reason why the firemen are on site. Okay. All right, let's see. That was WSU. Deficiencies of the classical pathway result in increased susceptibility to encapsulated organisms and this type of disease process, or you can also name the disease. Okay, let's see, who was that? Oh, yeah. Incorrect. I think we're looking for the disease process that the classical pathway deficiencies put you at risk for. UW? Incorrect. It's a good thought, but I think the encapsulated organisms is in the question already. All right, WSU? Incorrect. Incorrect. All right. The answer to this question is actually autoimmune disease and specifically lupus. So people with complement deficiencies are at an increased risk for lupus onset. Okay. All right. I again talked with my friend who's a fellow, an allergist. So promise I'm not making that up. All right. Let's see. Was that you guys? Yeah. All right. Want to pick another question? This is the most common primary immunodeficiency. UW. Incorrect. While it is in the name, it's a good thought. Let's see. WSU? Incorrect. Oh, yes. Sorry. They said HIV. Skagit? Correct. What is selective IgA deficiency? All right. Skagit? Michael Wolgamut's Dance of the Death from 1493 is a striking motif that arose from this illness. Skagit? Incorrect. Virginia Mason? Correct. Black Death or the bubonic plague. All right. Virginia Mason?
Why can't I read them?
These first-line therapies are used for acute attacks of hereditary angioedema. Name one. WSU? Incorrect. So since here, I'll answer a little bit more to that in a second. Let's see. Trios? That yes. Plasma kallikrein inhibitors. The name of it, acalantide, is actually the name of what to use. The other things that you can use for these patients, sorry, I didn't put the question up. Plasma-derived or recombinant C1 inhibitors. Icatibant is the bradykinin B2 receptor antagonist, and then also the plasma kallikrein inhibitor. So great thought. Glucocorticoids, antihistamines, and epinephrine are actually ineffective in folks with hereditary angioedema because it's mediated by bradykinin as opposed to histamine. So important to know. Okay, and let's see. So that was Trios, right? Familial hypocalcemic hypercalciuria is caused by this type of mutation in this receptor. Name both. Maybe. Yeah.
What is a missense mutation of the calcium receptor?
I think that probably, does anybody know if gain of function mutations are missense function mutations? Any basic scientists here? I think it probably goes along just enough that there is a mutation within the process that gives gain of function. So I think we can give Trios those points. Fair. So I guess it was a more specific answer. So yeah. Okay. All right. So Trios. Prenatal exposure to this medication has been strongly associated with autism. I know everybody's kind of like, wait, there's actually a medication that can do that. 5, 4, 3, 2, 1. Okay. So valproic acid is like the medication that is strongly associated with ASD. Yeah. I actually, it was, just to reflect overall for this category, as I was doing research on it, it was really, really disheartening to see actually how much work people have done over the decades to really describe what is associated and how we can try to help, and then to see the misinformation that is out there. So, all right. So let's see who, okay. All right. So for this question, so Multiple large epidemiologic studies have found no association between this vaccine preservative and autism. Trios. Correct. Yeah, thimerosal. All right. All right. So let's give Tony a second to let's give everybody a round of applause for Single Jeopardy. Tony is going to go through here. How are you guys feeling? Yeah. No matter how happy you are in the beginning, I think like the amount of like I remember Mo talking with me. She's like, everyone seems like really engaged and really happy in the beginning, and then you start getting like daggers throughout the entire process. So I will try to make things smoother for this next part. So for our current score, Virginia Mason at negative 1100. Madigan, yeah. Oh yeah. Well, hey, I mean, yeah, no participation trophy. Madigan at positive 300. Trios at positive 1300. WSU at negative 800. St. Joe's at 700. UW at 0. And okay, yeah, again, great. And then Skagit at plus 700. All right. So let's start. What was that? Did you have another comment, Connor? Yeah, proceed. Okay. So I believe we start with the person with the least amount of points. So let's see, which person is that Virginia Mason? I'm proud of you guys. Okay, so now for Double Jeopardy. Here are our categories. Famous fevers, G.I. Joe, brainworms, My Neck, My Back. That one is brought back after popular demand. And then wet reads. All right, so let's start with Virginia Mason. Famous fevers, 200. Julius Caesar likely suffered from this condition known as the falling sickness. Five, 4, 3, 2. St. Joe? Incorrect. 5, 4, 3, 2, 1. So epilepsy. Oh, yes. So a lot of historians, so people had actually thought that he had epilepsy or also maybe like mini strokes that actually affected his ability to rule and sort of led to a lot of the things that happened in the Roman Empire. All right, so we go, I think, back to Virginia Mason. King George III of England was believed to have this disorder that caused pain, madness, and purple urine. WSU. Correct. Porphyria. Mary, Queen of Scots, was also thought to have this diagnosis. All right, so WSU. Erythromycin is a second-line medication for gastroparesis and suffers from this phenomenon with repeat use. Trios. Correct. Tachyphylaxis. Wait, who did somebody? Oh, can you reset it again? You just got really excited, Skagit. Thank you so much. Appreciate that. So metoclopramide is actually the only FDA-approved medication for gastroparesis, but I'm sure a lot of the clinicians in here look at that and roll their eyes. Erythromycin and domperidone are other prokinetics to be used, but they actually aren't approved. This is a really tough diagnosis to help treat for our patients, and so I think it's important for us to know the different kinds of therapies. All right, so trios.
Brainworm or 200.
This protozoan is commonly contracted by immunocompromised patients while cleaning their litter boxes. Okay. Yes, toxoplasmosis. Let's also try to answer in the form of a question, please. Thank you. This is my cat when he was a kitten. I think Izzy probably has seen this photo before. Oh, you can't see it? It's too dark? Well, you can come up to me afterwards and I'll definitely show you photos of my cat using the litter box. All right, so let's see. That was St. Joe, correct? All right. This cystode can form brain cysts after transition from dogs, its definitive hosts, and if ruptured, can cause life-threatening anaphylaxis. Trios. Correct. What is a echinococcus? And just for, can you guys see that one okay? Not that it matters. It's not as fun. All right, trios. This hormonal analog is a first-line therapy for unresectable or metastatic pancreatic neuroendocrine tumors. Trios. Correct. So octreotide or lanreotide, the somatostatin analogs. As I was reading about this, it's kind of interesting. So the somatostatin receptor positivity is not strictly required to treat pancreatic neuroendocrine tumors, but they do benefit when they have it. Really important to know for people who have insulinomas, somatostatin or SSTR negativity is actually a contraindication due to the risk of worsening hypoglycemia if they're actually started on something like octreotide. So nice bit of trivia to know. All right, trios.
What reads?
This radiograph shows a finding that is commonly seen in inflammatory conditions. Let's see, who was that? Oh, UW? Correct. What is pencil and cup deformity? All right, UW? This finding on CT happens as a result of hypercoagulable states and hematologic diseases such as sickle cell disease. UW? Correct. What is splenic infarct? UW? Let's see. This finding on MRI is seen in patients that typically present with headache, nausea, and vomiting. Incorrect. Skagit was incorrect. Sorry, I didn't mean to call you guys out. Trios?
What is meningeal?
Incorrect. UW? Incorrect. Five. WSU? Incorrect. Great. So dural sinus thrombus. Yeah. As you can see here, the contrast lights up right on the posterior part of the scalp or the brain. All right. So Virginia Mason.
What reads Brazen?
Right. This finding on ultrasound is seen in patients with painful vision loss. Can you not really see? Or UW? Incorrect. Incorrect. WSU? Incorrect. You can't really see it. Is there a way to darken some of the lights right there so they can take a quick look so they have an equal chance? And then I think we'll say. No. I don't think so. All right, so yes. Incorrect. It is not vitreous hemorrhage. So the answer to this is globe rupture. Yeah. It's always reassuring to me when I think a question's too hard and then everybody has oh, that's right afterwards. All right. So let's see. Who was it back to you guys? All right. So this finding on PET CT happens more frequently with clomiphene citrate use and less frequently with oral contraceptives. Five, four, three, two, one. All right, this is a corpus luteal cyst. I don't know why they were doing a PET scan. Maybe there's better reimbursement for it. I don't know. All right. Let's see. Do we go back to, is this back to Virginia Mason?
Scratch over 600.
All right. So this is the most common ocular manifestation of Crohn's disease. Trios.
What is in
Incorrect. St. Joe. Correct. Episcleritis. Uveitis, dry eyes, and keratopathy are the other associated findings. I'll say when I was like thinking about this question, Trios, I thought the exact same thing because I think we're always taught to like look for anterior uveitis, but episcleritis is the most common one. All right, St. Joe.
G.I. Joe or Eagle?
Oh, daily double. All right. What is their current point total?
For this session.
Yeah. Well, I guess for overall. We're at minus 900, so you can wager up to 800. Yeah, which is the category.
500.
All right, so you'll wager 500. All right. What are the two diagnostic tests for small intestinal bacterial overgrowth? St. Joe. Okay. Five, four, three, two. Incorrect. Incorrect. All right. So actually, it is not the hydrogen breath test. It is a glucose or a lactulose breath test. And then the jejunal or duodenal aspirate is the other kind of gold standard diagnosis for SIBO. I don't think I've had any patient actually have this done before, just because of the I don't know, the tests I think are faulty in and of itself, and then also they cost a lot. All right, so let's see, was that St. Joe? All right. Mm-hmm. Yeah. I love that category. In gout management, this is the goal uric acid level when titrating urate lowering medications. Okay, let's not be super quick with the button, UW. Less than 5. Incorrect. Madigan. I think technically, as we had said before, after the answer, then we reset and then the buzzer goes. So Madigan, thank you. Less than 6, correct. That is 200 points, correct. All right, so Madigan. These are the most common medications associated with drug-induced lupus. Name both. Yeah. Mm-hmm. Five, four, three, two, one. All right. Nope. All right. Trios.
Hydrolysate and
I think that's incorrect. Okay. WSU. Incorrect. Madigan. Incorrect. All right. I knew it'd be too simple if I just asked for hydralazine. Yeah. All right. Doesn't seem like anybody's gonna get this. So what is procainamide and hydralazine? All right, let me see. That was 400. Okay. All right, so who was that, St. Joe? Or yeah, okay. Okay. After lens dislocation, this ocular finding is the most common manifestation, ocular manifestation of Marfan syndrome. WSU. Incorrect. Five, four, three, two, one. So what is myopia related to globe elongation? It's around 50% of patients with Marfan will actually have this. The other ocular findings are corneal thinning, flat or cone-shaped cornea, which is the keratoconus, and then the increased risk for retinal detachment, early cataract formation, and then also glaucoma. All right. All right, let's see. Does that go? Was that you guys? Or no, you got it. No one got it correct. So I think it's back to you. Yeah. Let's see. Beethoven is thought to have suffered from this cause of deafness. Five, 4, 3, 2, 1. All right. What is otosclerosis? Yeah. This one's kind of tough to tell, but I think there's been a lot of folks who have put a lot of work into doing analysis of what remains of Beethoven. Interesting, though. Oh, yeah, sorry, it's kind of dark. The genetic testing that was done on his hair also was done to look to find for the cause of his death, and they thought it was hepatitis, probably a combination of alcohol and autoimmune-related hepatitis. He also had markers associated with lupus, but they didn't feel as though that this was the likely cause of his deafness based off of the history that we know from him. All right, let's see. Is that back to St. Joe? This trematode can very rarely cause neurological complications such as pseudoterminal lesions and myelopathy, but is more commonly associated with dysuria and hematuria in Yeah, UW is now disqualified. Skagit is now disqualified because we haven't finished the question yet. So actually, since I don't think it was clear that I was finishing the question, you're still in play. But I'm going to read the question and I'm going to ask you to not press the button until it's done. Yeah, I'm going to start it over. This trematode can very rarely cause neurological complications such as pseudotumoral lesions and myelopathy, but is more commonly associated with dysuria and hematuria in farmers, fishermen, and irrigation workers. Trios. Correct. What is schistosomiasis? Yeah. All right. Trios. This cystode is the most common cause of acquired epilepsy in the world. I did write down neurocysticercosis here, but I think I'm actually looking for the name of the organism. So trios.
It's Teeny and Sol.
Correct. What is Teniasolium? All right. Trios? Okay. All right. All right. So Trios, what would you like to wager? You have 2,100 points.
500.
500. Okay. These free-living amoeba are known to cause the fatal granulomatous amoebic encephalitis, typically in immunocompromised patients. Name one. And again, this is just Trios. Yeah. All right, so 5.
Clostridium.
Incorrect. So acanthamoeba and balamuthia. I think we know acanthamoeba, I think a bit more from the keratitis that it can cause in folks who wash their contacts with tap water. All right, so do we go back to Trios? Yep.
G.I. Joe.
These medications can be used as copper chelating agents for patients with Wilson's disease. Name one. Trios. Correct. Penicillamine, trientine, and elemental zinc are medications that you can use for people. Interesting. I was treating a patient with Wilson's recently, and kind of subjective response to using zinc as like she had to take a lot of zinc and it caused a lot of GI upset and it really like she just couldn't tolerate it. So, all right. So trios.
Famous fever, 800.
Sir Isaac Newton was thought to have died from this condition related to his research. Trios. Correct. Mercury poisoning. Wait, was that Ken? Yeah. Correct. Mercury poisoning is how we think that Isaac Newton died. All right. Trios.
Famous fevers per thousand.
Nelson Mandela contracted this condition during his imprisonment. Correct. What is tuberculosis? So I was trying to figure out what he had died from, and I think he had actually died from a pneumonia, which they thought probably came from like scarring and chronic tubercular infections, but I don't think they believe that he died from a chronic tuberculosis infection. So, but that's correct. All right. UW. This medication is first-line therapy for cutaneous, mucosal, and articular manifestations of Behçet's disease. Trios. Correct. What is colchicine? All right. And then I think we just have one left. So this rare CNS side effect of rituximab leads to focal demyelination as a result of reactivation of this virus. Trios. Correct. What is JC virus in the setting of progressive multifocal leukoencephalopathy? All right. Let's give him a round of applause. We are now going to go into our final Jeopardy round. And so you should all have your pads with your pens. We're going to give you 30 seconds to answer the question after it has been given. Please put your wager. You can only wager up to the amount of points that you have. And I think if you have negative points, you actually can't participate in this round. But if you want, you can give an answer anyway. All right. Sure. We'll give Tony a second. Yeah, the guy who did it last year. Are you here? It was he was really stressed out last year with having to calculate the totals. Math in large group settings is not a good experience for anybody. Yeah. No, you're good. How'd you guys feel about the category names? Were they fine? Yeah. Creative, brainworms. Was that okay? Thought about broadening it to some other ID things, but it felt as though I really wanted to drive that point home about brainworms. Yeah, it's very topical. I was going to put some other photos of things for brainworms, but I decided not to. I want to hopefully keep this job. And I also want to get my public loans forgiveness. Woof. Yeah. All right. So what I think we're at for totals right now, I think Virginia Mason is at negative 1,600. We only have minus 500. Oh, for Virginia Mason. Okay. Okay, minus 500. Madigan is at positive 300. Trios is at 5,200. Ooh. WSU is at, is that a minus, Tony? That's a minus 2,800. St. Joe's is at negative 1,800. UW is at negative 800. And Skagit is at negative 700. So what I'm seeing is real-time feedback that maybe the questions were a little hard. But what I'll say for this is, obviously, I think to stick to the rules, I think Trios, and Madigan are the two teams that can compete, but there's actually no way I think that like Madigan would be able to win over Trios. So what we're gonna do is we're gonna have everybody participate because I think we know sort of what's happening right now. We're gonna have everybody participate, and I'm gonna request that the team that did really well wager the appropriate amount of points so that things don't go south. Does that make sense? So I think you've won. But just so we can do the question, don't wager all your points so you lose. There we go. Okay, great. So now that we have that, the category is bladder late than never. This is the most common metabolic abnormality associated with ileal conduits. Oh, if you're able to, once you put down your answer, let's send them up front so I can read them. All righty. Let's get all of our answers. I saw by the reaction, some of you think this is a very easy question. Other people think it's not. This is a common thing that you're asked when you're in the OR with a urologist. And it's burnt into my skull. Okay. So, St. Joe's, their answer is, what is a non-anion gap metabolic acidosis? And that is correct. But there's no points. Like, we can just like not do the points. Sorry. Sorry. VM, non-gap, non-anion gap metabolic acidosis for VM as well. So VM had it correct. Madigan is potassium wasting, which technically can happen in ileal conduits, but I think the most common acid-base disturbance that we're seeing is actually more the NAGMA. UW, the non-anion gap metabolic acidosis. Skagit, hyperchloremic metabolic acidosis. Thank you so much for putting that in there. That is it's an important one. I think it doesn't have the non-anion gap, but the hyperchloremic, I think, suggests the non-anion gap. WSU said B12 deficiency, which is incorrect. And then Trios wagered 2,000 points. I think you can kind of do whatever you want right now. And it is a non-anion gap metabolic acidosis. I wonder, before we give a clap, do you guys know the mechanism of why that's happening? Yeah. Yeah, great. So the ileal mucosa actually absorbs the ammonium and the chloride while the bicarb is lost in all of the urine. And then that results in the non-anion gap metabolic acidosis. The severity of the acidosis is actually related to like the length of the segment, the amount of contact time that it's actually in there with the tissue, and then also kidney function and urinary tract infections. All right, let's give a round of applause for everybody, and then also for our winners, Trios.